Hi, this is Kristen Howerton from Rage Against the Minivan.
And I'm Elizabeth Esther from elizabethesther.com.
And you guys are watching Right Mom, Left Mom, a show where two moms from different views talk about politics and try to keep it civil. So thanks so much to our viewers who've been watching and asking questions. And one of the things that it seems like a lot of people wanted to hear our opinions on was Obamacare. So Elizabeth, I'll throw it to you. What are your thoughts on the whole patient protection, PPCA, Obamacare thing?
I would start with number one, I do think there needs to be health care reform. I definitely am on that side. I think it's ridiculous that you can go bankrupt because you get sick in America. And I think that that's something that we need to resolve. I'm just not sure how we're going to afford it. I was reading this one thing last night, which I thought was funny. I mean, I know that they're going to increase taxes, but I'm just curious, like, how are we going to pay for it? And also, how will that affect the quality of care? Those are my two concerns. I was talking with some Canadian tourists a couple weeks ago, and she was telling me this story about her sister who got a really large mass in her leg and had to wait 8 months to get an MRI. And, you know, for us as Americans, that just sounds outrageous to have to wait for 8 months for something as basic as that. And so that, I guess that would be one of my concerns. And I think I don't feel like that has been really addressed yet, or like what the real life implications will be of that kind of healthcare reform.
Okay, so when you say that you are concerned about how we're going to pay for it, which part of it are you concerned that we won't be able to afford? Are you worried that the government won't be able to afford it, or are you worried that individuals won't be able to afford it?
Both. I'm worried that the government won't be able to afford it. That's, I think, hey, shh, I have a lot of kids here today.
Happens.
It's fine. So, yeah, I'm worried that we won't be able to balance the budget. I'm worried that it will just overload and bankrupt everything. But maybe that's an irrational fear. Is that even something I should be worried about at all?
Yeah, when I did a little research on the cost of it and the long-term effects, and it does look like in the short term it's going to be expensive. But they're estimating that the long-term effects is that it will actually lower the budget. I think, in effect, because what we've got going on right now is the government does provide health care for people who can't afford it, and then taxpayers end up paying for people who are uninsured. And the new system is really put in place to make sure that people who can afford it are getting insurance so that we as, a nation aren't paying for somebody being irresponsible.
Yeah.
So I'm not as concerned about the long-term effects, even though I think it'll, cost more kind of at the beginning. I do think it'll save money in the long term.
Yeah.
So you said you were worried about quality care too. Tell me about that. How do you think that this new plan is going to affect quality care?
Well, I think it would be something along the lines of what the Canadian tourist told me, which was, that her sister had to wait for 8 months just to get an MRI on a huge mass on her leg. And I'm just sort of extrapolating that out to our own context, like, oh my gosh, what if one of my kids, came down with something and we were put on this god-awful wait list and had to wait for months for something? I would feel like we had regressed, not progressed.
Well, I think what you're articulating is a fear that a lot of people hold, but I wonder, what you're comparing it to is a single-payer system, which actually I was in favor of, and we didn't pass that. What we passed was quite different. What we passed is really that your kids are going to be on the same insurance that you've already had. So I wonder if that's a realistic concern, that suddenly you're going to be on a wait list with the Obamacare that actually passed, which was a pretty conservative reform where most people will continue to have the same private insurance that they had before.
Well, that's good to hear. I guess I wasn't, to be honest, I hadn't kept up with it as much as I should have. And I think that any reform is better than no reform at all. So even if there are kinks and quirks, I want to see us work it out and try it out and see where we can go. So that's actually really encouraging to hear.
Good. Well, yeah, I think my opinion of Obamacare, it's funny because I'm coming from the other side where I actually wanted us to move to a single payer system. I think a reader last week asked me in what ways I considered myself somewhat socialist, and I do believe, I mean, first of all, no matter what political party you're coming from, we have socialist programs in the United States. We have roads, we have libraries, we have,
Yeah.
police. We have socialist programs, no matter what. And I think all of us, while we might not like that term, all of us are in support of some socialist programs. The question is which ones we're in support of. And to me, when you look at developed countries, when you look across the board at countries that are on par with the United States in terms of really offering a lot of services to their people, I think that healthcare is the one area where we seem really behind. And I think it's because we're kind of holding on to these ideas that somehow this is going to make us socialist. And when people say socialist, they mean communist. And there's a lot of confusion there. But I think, when you really look at all developed nations, everyone seems to be offering healthcare as a benefit to the community, the same way that we offer benefits of name 1,000 different government programs that we have to benefit from. So I thought that healthcare should have been added in, and I don't think that would have significantly changed the nature of our country to mean that we're socialist or anything like that. That having been said, it didn't happen. I was a little disappointed. I know a lot of people were. And what's concerning to me now is that what passed, in my opinion, is really moderate, but people are still screaming about it as if we passed a single-payer healthcare.
Yeah.
I think there's a lot of misinformation. I think what passed is relatively benign. I don't think it has an effect on most people in terms of either quality of care or price. And my hope is that the biggest effect it will have is that people who couldn't receive insurance previously will be able to get it. We're doing away with these pre-existing conditions thing. But I think a lot of people are really upset by this idea that you're now going to maybe have to pay a penalty tax if you don't get insurance. So what are your thoughts on that, on this sort of mandated,
the individual mandate? Yeah. You know what? That does not bother me. I was reading that last night, and I thought, I've heard a lot of conservatives sort of getting up in arms about the individual mandate. The government's forcing me to buy something I don't want to buy. And I think it's sort of an irrelevant argument because we pay taxes for a lot of things we don't necessarily want. Or, if you're homeschooling your kids, you're still paying taxes for public education. So I feel that that's sort of a moot point, and we can't just start picking and choosing which, taxes we will or will not pay. So that part sort of seemed like a moot point to me, and I think what concerns me more than that, like, sure, fine, if I need to buy into some thing, I'll do it. Like, that does not bother me. I think just my main concern was that, number one, that it would cost so much that it would overwhelm the government and it wouldn't be able to keep up. I see concerns that we're having a hard time even sort of how are we going to afford Social Security down the line? I mean, am I going to be able to retire, and is there going to be anything left for me and my husband? So how are we going to add healthcare on top of that? It was so funny. I saw this one thing last night that just totally cracked me up was part of it was going to be funded by X on indoor tanning salons.
Yes. Yep, that's a part of it.
I thought that was so funny. Like, I mean, so what's going to happen is all the tanning salons are going to go out of business because they're not going to be able to afford the tanning salons anymore. And then what do we do? Now who are we going to tax?
Oh, Elizabeth, you live in Orange County. You know those aren't going out of business. They're here to stay.
That's a long-term prosperous business model there.
Oh, my gosh. Yeah, so I mean, I think there are some interesting ways the government plans on paying for it. It does sound like people who earn over $200,000 will have a marginal tax increase. I think it's 0.9%, which is pretty small, pretty insignificant when we talk about tax increases. Although I can see where people are getting upset about that. But I think that for most families, it's really not going to have a significant change. I think most of us will probably continue with the insurance that we already have. And I think that it won't be affected in terms of quality of care. At least that's my hope. Do you have any other concerns with Obamacare?
No, that's it for now. I need to do more research, and then I'll come back to you with more.
I'm sure if you watch Fox News, you will learn that it is going to ruin the country. So
I'm sure my readers will fill me in on
right,
what I should be more
they
serious
will.
about.
In fact, those of you watching, we would love to hear your opinions on Obamacare. What do you think about the plan? Do you think we should have been on a single-payer system? And if not, do you have concerns about the current plan and how it's going to be implemented and how it might affect you? Leave us comments and tell us all about it.